All right. Welcome, and thank you everyone for joining us today for this webinar on the Walk Cares Fund. Today we're going to be covering Walk Cares Basics, what workers need to know. My name is Kristen Mackey, and I am the Walk Cares Fund Community Relations and Outreach Program Manager. And Jeff, do you want to go ahead and introduce yourself?
Great, thanks, Kristen. My name is Jeff Kindle. I'm a service delivery manager with the Employment Security Department's Leave and Care Division, and we handle all of the exemptions for the Walk Cares program, as well as employer reporting. Back to you, Kristen.
All right, thanks, Jeff. So we are going to have time at the end of today's presentation to answer any questions that you may have. Anyone who's joined us on a computer or using the Zoom app on their phones can submit their questions through the Q&A function at any point in the presentation. If you joined by calling the phone number but want to be able to ask a question, then you can find the link to join by computer or the app on our website at walkcaresfund.wa.gov/webinars or in the email from Zoom in your registration. So we're going to go ahead and start by defining what we're talking about when we say long-term care or caregiving. Long-term care is help with activities of daily living like bathing, eating, dressing, preparing meals, grocery shopping, and more. It does not include medical care like doctor's visits and treatments for medical conditions. Long-term care covers a really broad spectrum of needs and circumstances, including for younger people who have been unexpectedly injured or become disabled or ill. And a lot of people don't realize how many different services and supports are included when we talk about long-term care. We often think of it as care in a residential setting, like a nursing home or assisted living, but it can also include care provided in your own home. And in fact, most people who have long-term care needs can stay in their own homes with the right support. It's also really common for family caregivers to not realize that they are a caregiver. You might go to your mom's house a couple times a week to cook meals, drive her to appointments, and make sure she's taken her meds, which are all common care activities. In fact, the majority of this type of care is provided on an informal basis as unpaid care from a family member, a friend, or a neighbor. So I am going to go ahead and launch a quick poll about your experience with long-term care and caregiving and how familiar you are with Walk Cares. If you joined by computer or by the Zoom app, I appreciate it if you could go ahead and give us a quick answer to help us learn more about who we've got in the audience today. And we'll see in just a moment what the responses to the poll tell us about this group's experience with caregiving. But generally speaking, we all have care stories in our families and our communities. Family caregiving is really the bedrock of long-term care. There are 820,000 family caregivers in Washington state, which is about 11% of our population. And I want to share a quick story from a Washington family that's doing the kind of caregiving that Walk Cares is designed to help support. So this is, this is Sunny and Yenny.
My mom was a nurse anesthetist in Korea, and we're both nurses, so it kind of runs in the family.
That was part of the reason why we were able to come here in 1974, because she had worked as a nurse and they wanted nurses to come, so she was able to bring the whole family.
Just a couple of years ago, we started noticing that my mom started to have some cognitive decline, kind of on the spectrum of dementia. Yenny and I have had to kind of put our jobs on the back burner to really help take care of my mom.
Some days were good, some days were very difficult. I mean, it's our mom, and there's nothing I wouldn't do for her to make sure she stays as independent as possible with the support that we can give her.
If we had a resource like Walk Cares, that would have been so helpful to just kind of ease some of our financial burden in trying to do this. It's very difficult. So we try to simplify her life. We do her grocery shopping. She often will come with us, and cooking, cleaning, cutting her hair, taking her out socially, but we're creating meals that she is familiar with and that she enjoys. And we like to bring her out to do fun things too, and not just like all medical all the time. believe me, it will affect you, whether you're younger or older. To have a resource like that and to know that the state is investing in families, that means a lot to me. Walk Cares is a program that I think will benefit everybody.
Okay. I am gonna go ahead and, oh, looks like we lost those poll results. I got a quick look before they went away though. There we go, thank you. Looks like we've got a lot of people who have provided this kind of unpaid care to a family member or loved one, about 35% of the people who responded, as well as some folks who have other experiences with long-term care, working in the field or receiving long-term care services. Looks like most people are either somewhat familiar with Walk Cares or not very familiar. So hopefully what we have to cover today will be helpful for everyone to get an overview of the program. So 70% of us will need long-term care at some point in our lives, but the problem is that long-term care can be really expensive. It costs almost $36,000 per year for 20 hours of home care per week, which is the average that's needed by current Medicaid long-term care clients. And it's also important to keep in mind that family caregiving isn't free either, and we'll talk a little bit more about that in a second. But because long-term care is not medical care, it's not covered by health insurance or Medicare, except in very rare circumstances. And it's only covered by Medicaid after you've spent down your life savings to just $2,000. Even though long-term care is a predictable cost, most of us don't have a way to pay for it. The median household income for Washington seniors is about $56,000 per year, and that is a household income, not individual. And when we look at workers near retirement and how much money they have available through retirement income from pensions, 401ks, or IRAs, 41% have no projected retirement income, and another 42% have no pension and only enough 401k or IRA savings to replace 10% of their pre-retirement income. So that means that not only do people not have enough money to pay for long-term care, most don't even have enough money saved for a comfortable retirement. This is especially critical because our population is aging really rapidly. The number of people who are 85 and older, which is the blue line on this graph here, will more than double between 2020 and 2034. And the caregiver support ratio is declining sharply. So that just means that a lot less family support will be available for people in the high-risk years for needing care. And if you're a family caregiver, you're going to be a lot more likely to be providing care for multiple loved ones at a time. So as a society, we have to figure out if families are not able to shoulder this burden, how we can provide better support for caregivers and how we can help families with these long-term care needs. While Walk Cares may seem like a new expense for workers, it's important to keep in mind that the current system where we rely on unpaid family caregivers to provide the vast majority of care isn't actually free for those families. Almost half of family caregivers experience a related financial setback. And on average, they spend about 25% of their own income on care-related expenses. It's really common for caregivers to have to leave the workforce early in order to provide care. And caregivers 50 and older who do this lose an average of more than $300,000 in wages and benefits. And most working caregivers say a program that paid them for the hours they provide care, like Walk Cares will be able to do, would be helpful. There are also impacts in the workplace. The majority of caregivers work full-time on top of their care and family responsibilities, and most report that it impacted their job in some way. Over half say that they had to go in late, leave early, or take time off to provide care. 15% reported reducing their hours. Many, about 8%, reported receiving warnings about their performance or attendance, turning down a promotion, quitting, retiring, or losing benefits. And while many caregivers find their role rewarding, it can also be highly stressful, and nearly 1 in 4 report that their health has worsened since they took on the role. Long-term care is also a significant driver of the state budget. It accounts for about 8.9% of the state budget right now. We don't often think about it, but these costs are paid for by all of us through taxes on goods and services. And as our population ages, costs will rise accordingly without an intervention like the Walk Cares Fund to help. So with all of these challenges in mind and facing a projected doubling of Medicaid long-term care costs by 2040, the legislature's Joint Executive Committee on Aging and Disability began a search in 2014 for some kind of a long-term care policy innovation to help address this problem. They worked with a really broad group of interested stakeholders and looked for a solution that would support families with resources to make it easier when a loved one needs long-term care, that would provide affordable coverage for all workers to help protect them from becoming impoverished when they need long-term care as they age, and protect Washingtonians from the significant tax increases that would otherwise be needed to fund Medicaid to cope with the long-term consequences of our aging population. So that committee spent several years working with stakeholders, with policy experts, actuaries to explore both private and public solutions. And after extensive research on each of those approaches, the findings were clear that a program like the Walk Cares Fund that covers everyone, similar to Social Security and Medicare, is the only way to provide affordable coverage for all. We also know that universal coverage, where everyone participates in the program, is a best practice in public pension, healthcare, and long-term care insurance programs in capitalist countries throughout the world. It ensures that the program can cover everyone at a low, stable rate, regardless of their age, their gender, or their health status. So with all of that research and best practice in mind, in 2019, the legislature enacted the LTSS Trust Act, creating Walk Cares. And in 2021 and 2022, the legislature made improvements to the program's coverage and benefits. Workers began contributing and earning benefits in July 2023. And in July 2026, the benefit will become available to those who qualify. So let's talk a little bit more about how Walk Cares works. Walk Cares is a universal long-term care program in Washington state. It's an earned benefit, which means you contribute for a certain number of years in order to qualify for benefits. And it's entirely self-funded from worker contributions, which go into a dedicated trust fund used only for this program. You, as a worker, contribute 0.58% of each paycheck to Walk Cares, and you can see here what this looks like for the typical worker who makes just over $50,000 a year and would contribute $291 each year, or about $24 a month. You only contribute to Walk Cares while you're working. Contributions stop when you retire or if you become unemployed. And everyone is covered at the same rate, regardless of pre-existing conditions. And when it comes time to claim your benefits, there are no copays, no deductibles, and you don't need to file claims or pay upfront for services. Instead, the program will connect you with contracted providers who offer the services that you want and pay them directly. This is what those contributions can look like over the course of a career. So you can see that typical worker income we talked about is just about at the level in green here in the middle. And you can see that $290 in contributions each year totals out at $8,700 over 30 years. And I will hand it over to Jeff for the next couple of slides.
Thank you, Kristen. For this slide, so let me start by saying almost all Washington workers contribute to Walk Cares. And to determine whether someone counts as a Washington worker, we look at whether their work is localized in Washington. Determining whether work is localized in Washington can be complicated, but because we use the same definition as the state's paid family and medical leave program, that gives us an easy rule to work from, which is basically workers who are included in paid leave will also be included in Walk Cares, unless they have an approved Walk Cares exemption from the Employment Security Department. If you're not sure whether you participate in paid leave and Walk Cares, you can check your pay stubs or ask your employer for more information. If your work is not localized in Washington, you are automatically not included in paid leave or Walk Cares. No need to file for a Walk Cares exemption. Federal employees are also automatically not included in the Walk Cares program. Employees of tribes are only included if the tribe decides to opt in, as well as self-employed individuals are only included if they opt in. Other workers can get an exemption from WACARES, which they must apply for with Employment Security Department to receive. And some workers can apply for an optional exemption based on meeting certain criteria. This includes workers who live out of state, temporary workers with non-immigrant work visas, and spouses or registered domestic partners of active duty military. These 3 exemptions were created for groups of workers who would be unlikely to qualify for or use their benefits. They are available on an ongoing basis and are conditional, meaning the person must continue to meet the exemption criteria to maintain their exemption. There are also 2 types of permanent exemptions. Veterans with a 70% or higher service-connected disability rating who have access to some nursing home care through the VA can choose to apply for a permanent exemption. These applications are available on an ongoing basis as well. There was also an exemption available in the past for workers who had private long-term care insurance before November of 2021. These applications are no longer available. Under the current law, workers who already have an approved private insurance exemption will continue to be exempt permanently. For details on applying for an exemption, you can visit the website wacaresfund.wa.gov/exemption. Next slide. Oh, one moment. There we go. If you are self-employed, you can choose to opt into the WACARES Fund and protect yourself with the same affordable benefits available to other Washington workers. Like other workers, you would contribute 0.58% of your earnings. This includes your net earnings and any gross wages paid to you from your business entity. To earn the benefits, you must work at least 500 hours per year. And for self-employed people who elected coverage, this is calculated by dividing your gross annual wages by the current minimum state wage. Applications to opt in became available in July, and you can learn more from the website again at wacaresfund.wa.gov/opt-in. Next slide. So let's talk about the role of your employer versus the role of the Employment Security Department. As of July 1st, 2023, your employer automatically deducts your WACARES premiums from your paycheck, unless you have provided them with an exemption approval letter or are a member of one of the other exempt classes. Your employer is required to keep your exemption letter on file. The Employment Security Department is the state agency responsible for processing the exemption applications and providing exemption approval letters for workers to give to their employer. They also process elective coverage applications. If you got a private insurance exemption prior to 2023, your letter is still valid and you can use it with any current or future employer. If you can't find your exemption letter, you can download a copy from your Secure Access Washington account, the same account that you used to submit your application, and your letter is stored right there in your documents. With that, I'm going to turn it back over to you, Kristen, and thank you.
Okay. So next, we're going to talk about how you qualify for benefits. So everyone who is contributing to WACARES Fund more than 500 hours per year is earning benefits, part-time and temporary workers included. And by contributing for a certain number of years, you earn access to the benefit amount. There are 3 pathways that you can use to meet the contribution requirement. The first is early access. So this is for workers who have not yet been able to earn lifetime access, but have a care need either while they're working or soon after leaving work. And so to qualify through this pathway, you need to have contributed for at least 3 of the past 6 years at the time that you need care and apply for benefits. The next is lifetime access, and this is the pathway that we expect the majority of Washington workers will use to qualify for benefits. To use this pathway, workers must contribute for a total of 10 years without a break of 5 or more consecutive years. And finally, we have a special pathway that's just for people near retirement. If you were born before 1968 and were therefore near retirement as the program has begun and are unlikely to be able to qualify for that 10 years pathway, this pathway will ensure that you have permanent access to a prorated benefit amount. So people in this group will earn 10% of the full benefit amount for each year that they work. So for example, if they work and contribute for 500 hours or more a year for 3 years, you would earn 30% of the benefit amount, or just under $11,000, which is adjusted for inflation. New retirees will have permanent access to whatever percentage of the benefit amount they earn at any time that they need care. They are also able to qualify through one of the other pathways if they meet those requirements. Once workers meet contribution requirements and need help with at least 3 activities of daily living, they can get access to the benefit amount, which is a $36,500 budget for services and supports. That is a lifetime benefit, and it will increase over time with inflation. With WACARES, workers get the flexibility and the freedom to choose the services and supports that meet their needs. So that could mean in-home care, it could even mean residential care, but it could also include things like home modifications to make your house safer, and assistive technology for things like medication reminders and fall detection that can help with some care needs. WACARES is really designed to help people age in place in their homes as long as possible. That's what almost all of us want to do, and most of us can if we have the right supports in place. So WACARES also has many options that provide support for family caregivers. You can choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid, even your spouse. And WACARES can help lessen the impact on family caregivers by paying them for their time or making sure that they can get other support services. Under current law, you must be a resident of Washington State in order to use benefits. However, the LTSS Trust Commission, which oversees WACARES, has recommended to the legislature that benefits be made portable for people who contribute but leave the state before they need care. And we will talk a little bit more about that recommendation later on. We get asked a lot about how far that benefit amount will go, and it won't cover 100% of care for everyone, but it would cover the amount of in-home care that the average Medicaid client uses for roughly a year. About 1/3 of people need care for a year or less. So for those people, WACARES may be able to cover all of the care that they need. For others, WACARES provides the family with immediate relief and time to plan for future care costs. These are just some examples of how someone might use their benefit. So you could pay a family member to care for you for about 10 hours a week for 2 years and get care supplies for a total of about $33,500. Or you could choose services to help you stay safely in your own home. You could purchase $15,000 worth of renovations like bathroom modifications or a wheelchair ramp to improve your home's accessibility, get an electric wheelchair or a scooter, and have meals delivered for 3 years for around $26,800. Or someone who needs long-term care due to an unexpected injury could get 20 hours of in-home care per week for a year, plus transportation to appointments and crutches for about $34,600. WACARES is a cross-agency program, and there are multiple state agencies that have responsibilities in designing, developing, and implementing the program. If you have questions about exemptions or opting in, ESD is the right place to go. If you have other questions, you can connect with DSHS, and you'll also work with DSHS in the future as you apply for benefits and get a care need assessment. HCA has a responsibility for paying providers, and the Office of the State Actuary is responsible for ongoing analysis to make sure that the fund stays on solid ground financially. And finally, before we open up for Q&A, I want to talk about just a couple things that are coming up in the future for WACARES. So like I mentioned, our oversight body, the LTSS Trust Commission, has made some recommendations to the legislature and to the agencies that administer the program in 2023 and 2024 on a number of topics. There are 2 key topics that I want to highlight here, which were benefit portability and supplemental private insurance. So the commission recommendation on benefit portability is to allow anyone who leaves the state after contributing for 3 or more years to elect portable benefits coverage and make benefits available to those workers if they need care after moving out of state. And then supplemental private insurance, those recommendations focus on creating a market for private long-term care policies that work seamlessly with walk-cares with some additional consumer protections. These policies would allow folks who want more security to buy additional coverage. And you could then use your walk-cares benefit during the waiting period that private insurance policies have, which is a specific period of time where you have to pay out of pocket for care before your policy kicks in. And then once you use all of your walk-cares benefit, your supplemental private policy would continue to cover you. Those recommendations will require legislative action to implement, and you can find more detail on those and other recommendations from the Commission at wahcaresfund.wa.gov/commission. Another topic we're getting a lot of questions on right now are an initiative to the legislature that has been filed related to walk-cares, as well as some bills that have been filed in the legislature. And our role at DSHS and ESD is really to implement the program as it's outlined in current law. So we are continuing to do that, and we will adjust our implementation if changes are made to the law. It's not our role to speak to the details of any specific initiatives or proposed legislation, so we won't be able to answer specific questions on those topics. However, there are some links on your screen, and maybe we can drop those into the chat as well, where you can find more information on initiatives, including the initiative process and language of specific initiatives, as well as any bills in the legislature. And with that, I am going to go ahead and open us up for Q&A. So let's see where we're going to get started here. We are getting a lot of questions about accessing, a transcript or a recording or being able to access the slides. And that will all be available on our website at wahcaresfund.wa.gov/webinars. So likely the same place that you went to register for the webinar, you'll also be able to find the slides and a recording of the webinar. So let's see what else we've got here. So we have someone asking whether walk-cares is open to anyone who contributes, or if there are exams, interviews, et cetera, as with private long-term care insurance. The insurance is, in terms of who contributes, it is a near universal program. So almost all workers in the state contribute. There are no underwriting. There's no underwriting that would rule out people with pre-existing conditions, or that would price your rate differently depending on things like your gender or your health status. So everyone participates, but then when it gets to the point where you need care, there will be a care assessment to make sure that you need help with at least 3 activities of daily living. Once we've confirmed that you've met contribution requirements and that you do need that help with activities of daily living, then you're able to access your benefit. We've got someone asking about folks who are nearing retirement and how you can take advantage of this program if you need it. There are kind of 2 ways. We touched on just a little bit ago on how near retirees, I think, are most likely to be able to access the program. The first is the pathway that is just for near retirees. So anyone who was born before 1968 earns 10% of the full benefit amount for each year that they contribute. So that is the primary pathway. But it's also possible if you're nearing retirement, if you need care soon after you stop working, then you may be able to qualify for the full benefit amount through the pathway where you have early access if you've worked 3 of the last 6 years at the time that you need care. We've also got folks asking about whether dependents are covered under your long-term care premiums under walk-cares. No, your walk-cares benefit is for you to be able to access long-term care services that you might need later in life. We've got someone asking, can AFH, I believe adult family home workers, qualify for this program too? Yes, adult family home workers will be able to be providers for this program, and they would likely also contribute to the program as well and participate as beneficiaries. And then let's see, we've got someone asking if we have a remote worker in other states, do they still need to apply for an exemption, or is the fact that they live out of state sufficient? Jeff, do you want to take that one?
Sure. If they're not localized in the state of Washington, then there is no need to apply for an exemption, even if they work occasionally in the state of Washington. They wouldn't be eligible for the program based off of the fact that they're not localized in Washington. There would be no need to apply for an out-of-state exemption.
Thank you. And then we'll go through a couple, we've got a couple of ESC questions here. We've got someone asking if an employee has an exemption due to living out of state, do they lose the exemption if they move into the state?
Yes. The out-of-state exemption is actually one of our conditional exemptions, meaning when your status changes, that could also affect your exemption. If that individual were to move into the state of Washington and is still earning Washington wages, they would need to notify ESD and their employer, and the employer would start collecting the premiums for that individual.
We've got someone asking, as an employer with a private plan for paid leave, we're having problems with our payroll provider filing the walkers' wages and paying premiums. Is there a way to file and pay walkers only and not report paid leave at the same time?
Yes, there is. I would encourage you to reach out to our employer, like give us a call. We'd be more than happy to go through that with you. I'm not quite sure the logistics off the top of my head for that, but if you were to call in, I think you hit number 3 for employer questions, and we can get that answered for you.
Great, thank you. All right. Then we've got someone asking, let's see, can family members access benefits for you if you're not able to do this on your own? We are still developing what the process is going to look like for accessing benefits, but that is something that we're exploring for people to be able to identify someone who can help them apply for benefits and manage their benefit. So that's still in progress. Then we've got someone asking, how does someone start benefits if you don't have to file claims? And so essentially it works a little bit differently than like an insurance process where you file claims and get reimbursed. What happens is when you need care, you will apply to access your benefit. And we will confirm that you have met contribution requirements, and then we'll do what's called a care need assessment. So DSHS will check in with you and make sure that you need assistance with at least 3 activities of daily living. And then once you are approved to start using your benefit because you've met those contribution and care need requirements, you'll be able to find an approved contracted provider with the program, and then you'll be able to access your benefit through that provider, and WalkCares pays the provider directly. So instead of you having to pay upfront for the services and get reimbursed, you're just receiving the services and WalkCares pays the provider. We've got, let's see. Someone asking, would a history of mental health diagnosis be an obstacle of access? No, WalkCares does not have any access barriers for folks who have pre-existing conditions. And we've got someone asking, I have an employee who is exempt. Do I still need to file her exemption if her last employer filed it? Jeff, do you want to take that one?
Sure. So as long as they provided the exemption letter to you, the employer, and the effective date is prior to the day they started with you, there's no action needed, and you don't have to withhold premiums for that individual. There's no need to notify ESD or anything. When you go to report for the other employees, you would just say that that person is exempt. That's one of the options when you go to file the quarterly reports.
And then we've got someone asking, can you use both private insurance along with walk cares? And you can. Walk cares will work with private insurance. Most private insurance policies have a waiting period where you have to pay out of pocket for care for a certain number of days before your private policy kicks in. So walk cares can help cover that waiting period for you so that you're not having to pay out of pocket for that amount of time. And then let's see. We've got someone asking, are employees required to routinely confirm that they still have active, valid, private long-term care insurance? And Jeff, do you want to take that one?
Sure. The short answer is no. There's currently nothing that dictates an employer or ESD has to confirm their ongoing private. If they got the exemption under the private long-term care exemption, there's nothing that requires us to review that at regular intervals or the employer. And that is a permanent exemption. So even if they were to cancel even if with the cancellation of a policy or anything like that, they would still be exempt. It's forever.
Let's see. We've got someone asking whether you will be limited to a list of providers approved by the state and whether there is a limit that you could pay your relatives for home care. So in terms of providers approved by the state, yes, you do have to use a registered provider because we have to make sure that folks are qualified to be providing the long-term care services that you're receiving. And in terms of how it's going to work for family members, they will need to participate in some training to ensure that they are able to maintain health and safety for themselves and for their loved one. But then you'll be able to employ a family member to provide that care for you, either through the consumer-directed employer, which specializes in supporting those individual family member providers, or a home care agency. And then we've got people asking, several people asking about folks who work less than 500 hours per year and whether premiums are still withheld for those workers, and they are. Everyone who is a worker whose work is localized in Washington who does not have an exemption contributes. The 500 hours requirement is how many hours you have to work in order to qualify for a qualifying year towards being able to access your benefit. And then let's see. We've got sorry, just looking for a question that we haven't answered yet. Jeff, maybe you can answer this one. It's about self-employed folks. If someone who's self-employed who's opted in found a full-time job later, will the years that they contributed earlier count?
Yes. I had to think about that one for a second. So whatever you paid through elective coverage is still kind of in your bank. And if you change employers and go full-time and they continue to withhold the premiums because you did not file for an exemption, and then yes, like all the hours and wages would count towards eligibility later.
Thank you. We've got a question asking if there's a specific website or PDF that you can provide to employees to give them direction about how to access benefits and how the process works. I am going to drop a link in the chat here to our website, wcaresfund.wa.gov. There is a ton of information available on that website. In particular, as an employer, you may find our toolkit page helpful. That's available in the menu or just at wcaresfund.wa.gov/toolkit. That has a ton of resources that you can provide, fact sheets, posters, frequently asked questions so that you can answer employee questions. So hopefully you'll be able to find some helpful information there. Then we've got someone asking if the long-term care will be available via private providers, who will be paying them, state, or will it be taken from the funds that I got approved for? So you can think of your benefit amount as kind of a budget that you use to get services and supports. So the providers are paid out of that budget that you've been approved for, which is that $36,500 benefit amount. And then, yeah, so once you use up that benefit amount, then your walker's benefit is gone essentially. So let's see. What else do we have? We've got someone asking kind of what happens if they retire with only a percentage of the benefit and don't want to or can't work 500 hours per year on a continuing basis, asking if there's a cash payment option. So there's not a way to get your benefit in cash, but you will have access to that percentage of the benefit amount in long-term care services at any point in your life later on when you need care. So that near retiree pathway and that percentage is a permanent benefit amount that you're able to access at any time. Then let's see. We've got some questions. We've got someone asking about how to apply for benefits if you are self-employed. Jeff, do you want to reiterate that one?
Sure. We actually have that technology through the Secure Access Washington portal now. You would log in like you're looking at the exemptions, but you would choose the elective coverage option, and it would process that way. So it's through your Secure Access Washington account.
Thank you. And you can find more information on opting in on our website at wcaresfund.wa.gov/opt-in. We've also got some folks asking where they can access the exemption application for staff. So that is also available on our website. That's at wcaresfund.wa.gov/exemptions. And you can find information that you can share. You can share that link. It's an online application for the exemption. We've already talked about portability a couple of times. Oh, here's one. So we've got someone asking, as a near retiree, they'll only get 1 year of contributions in, asking if they can continue to pay in after retiring to get a benefit of more than 10%. At this point, there is not a way to continue contributing if you're not working. If you are working part-time after you retire, some people do keep a part-time job. If you end up continuing to work a little bit, you can still be earning years that way. Or what might also be an option, assuming that it gets passed by the legislature, is that supplemental private insurance that we talked about. That may be another place where you're able to get some additional coverage that will work seamlessly with the walker's benefit you do have, and that has some additional consumer protections in place. And let's see. Answered that. I think we answered that as well. We've got someone asking about quarterly reporting. So this webinar is focused on workers, so we don't have reporting information available. If you are interested though in one of the past webinars on reporting, on the webinars page of our website, which is at wcaresfund.wad.gov/webinars, you can find recordings of past webinars, or you're welcome to reach out to ESD as well for more information. And let's see. I'm not sure, Jeff, if you'll be able to answer this one live, but in case you can, we've got someone asking what happens if a employer only recently found out about the contribution requirement? Do they have to go back to July 1st of last year, and can they deduct that amount from paychecks? Is there a penalty? Is that one you're able to answer, or?
I can answer a couple of parts of it.
Okay.
I know as an employer, you cannot go retroactively and deduct it from employees' paychecks. As far as the other parts of that question, they're very good questions, and we would need somebody from our employer reporting team to get the answers for that for you. And I would encourage you to give us a call, hit the employer prompt, and one of our employer reporting team specialists would be more than happy to walk you through that.
And then we've got folks asking about qualifying years and whether it's July 2023 to August 2024 versus a calendar year. I don't know, Jeff, do we have an answer on that one?
I'm sorry, could you repeat that? Repeat the question for me?
Asking about qualifying years and whether that's a calendar year or if it would be like a year from July 1st, 2023, when people started contributing.
I don't think we have an answer on that quite yet. I think that's still being determined. Yeah, I think that's our answer right now. Is we're working on it, because it definitely creates. Please go back to July. It kind of creates that mid-year start finish thing.
All right. And then someone asking about the 10-year requirement. And if you were, for example, laid off, then if you're not technically working for a period of time, do you still qualify under the 10 years rule? So right now, the requirement is that you work 10 years consecutively without a break of 5 or more consecutive years. So or I'm sorry, a total of 10 years without a break of 5 or more consecutive years. So if you work 10 years, but you had a break in the middle of that 10 years where you weren't working for, say, 6 years in total, then your kind of counter for qualifying years starts again at 0 when you return to work after that more than 5-year gap. However, that is one of the recommendations that has been made by our oversight body to the legislature is that that requirement be simplified to just a total of 10 years, regardless of whether you have had a break in the middle of that, or if you've worked for 2 years and then had a break, and then worked for 3 years and had a break. And as long as you get to a total of 10 years, that would simplify that requirement. So still to be determined if the legislature moves that forward. Okay. And then we've got a couple of folks with some pretty specific questions asking for like who have reached out and not been able to get through to someone. So I do want to just let folks know that any questions that we aren't able to get to during the presentation, we will follow up afterwards by email and respond to your questions. So you will get an answer to the questions that you've entered, even if we're not able to get to you live on the air. So hopefully that will help for some of the folks who have really detailed questions about their situation that we might need to answer after the fact. We've also got folks asking, we've got someone asking, what about someone who passes away, who qualifies, contributes for enough qualifying years, but passes away before they're able to use their benefit, and will family members be able to access the benefit amount instead? That's not how the program is structured. In order to keep premiums low, benefits are only able to be redeemed by the person who is paid in. So your benefit is for you to be able to access long-term care services. And that's the only thing that it's able to go toward. We've also got someone asking whether benefits are only for in-home care or if they can be used in assisted living, and they can be used for a really wide range of services, including care in assisted living or in a nursing home. We tend to emphasize in-home care because that is the way that we see a lot of the current Medicaid long-term care clients using their long-term care benefits right now. We know that most people want to stay in their own home and age in place, and a lot of people don't realize that you can get long-term care in home. So we do talk a lot about in-home care and some of those kinds of services that can help you stay in your own home for as long as possible, but you are also able to use your Walk Cares benefit in a nursing home or assisted living. We've got someone asking whether siblings can take care of other siblings as the paid family caregiver, and the answer is yes. We've got someone asking about whether cognitive impairment triggers Walk Cares as it does in private long-term care insurance. And we, the way that the program is structured, we look at activities of daily living and people's ability to complete those activities with or without assistance. We're still working out some of the details of what it's going to look like to qualify for like what those like details will look like. That's something that we're still figuring out. So some of that is still to be determined, but there's a little bit more information about that on our website as well. Let's see. So for someone asking for early retirees, do you get credit for working a partial year, or do you only get credit for every 12 months worked? That is where the 500 hours requirement comes in. So it doesn't matter if you work 500 hours over the course of a few months, or if you work 10 hours a week and work 500 hours over the course of an entire year. As long as you've met that 500 hours requirement, you're earning a qualifying year. And we've only got a few minutes left. We've still got quite a few questions. So we will definitely be following up with some folks after the webinar, but I am going to go ahead and move us on to our last couple of slides. And then we will follow up on these remaining questions after the webinar is over. So just a couple more things that we want to share before we close out. So this is just a quick recap. I did see also a couple questions from some folks asking what happens to your Walk Cares benefit if you don't use it, and how that still benefits people. And so this is kind of a recap of how Walk Cares benefits you, your family, and your community. You might receive a direct benefit from Walk Cares, either by receiving care yourself or by getting help caring for your loved ones. But you may also see the impact of Walk Cares at work as your coworkers with caregiving responsibilities get more support. And not only will Walk Care serve as a financial resource for families, but the ability to make a loved one a paid caregiver will help keep the benefits that workers earn in their families and their communities. Walk Cares will also ensure that workers throughout the state can access affordable long-term care coverage for the first time, and it will lower the costs of long-term care spending that we all pay through taxes. So Walk Cares, through all of these different ways, will help Washington families meet the challenges of our aging population and ensure that workers have more choices to help them live with dignity and independence as they age. And finally, I wanted to share some resources for you. As I mentioned before, you can find the materials from this webinar on our website at walkcaresfund.wa.gov/webinars. We'll have a recording, we'll have the copy of these slides available. And you can also, if you still have questions that you weren't able to submit in the Q&A, then you're welcome to reach out to our customer care team, either using the email form on our website, which is linked here on screen, or at either of the phone numbers on screen, depending on, oh, sorry, that just went away. Let me pull that back up. Depending on what question you have, you can use one of the two phone numbers that are up here again. There we go. And then we will be following up with any folks who dropped a question into the Q&A who we weren't able to get to during the presentation. And with that, I'm going to go ahead and close us out for the day. Thank you so much to everyone who was able to join us. We really appreciate your time and hope you have a great afternoon.